We start with this lady who had a venous leg ulcer of coming up to 3 years, 2 3/4 years, 2 years, 9 months. The venous leg ulcer is on the left. And the biggest deal for this lady was she was working, I think she worked in Tesco, and she was on her feet a lot, and she was getting a tremendous amount of pain with her wound. The issue we had in her adjunct therapies like compression therapy and things, she just wasn't tolerating because of the pain levels that she was experiencing. So we start with a wound of around about 12 by 6 centimetres, which is around a wound area of 72 centimetres squared that was too painful for compression. After 3 weeks, so it's what like Hans-Peter talked about, it's just one application of 60 minutes with the 𝗙𝗵𝗲𝗺𝗏 cream first. She did find it painful as we did it because she had quite a sensitive wound, and it's not without pain. The 𝗙𝗵𝗲𝗺𝗏 cream did do a lot to try and reduce that down. What she did talk about, so unfortunately we didn't get a picture at day 7, but what she did talk about the next time we saw her was actually she went for her normal pain relief on day 1 of having used the Debridement, and she found she didn't actually need her pain relief to the same degree. So she just said she sort of almost automatically reached to get her painkillers in the morning and her pain had gone. So she went from a pain scale of 10 in the wound to a pain scale of 0. I'm not necessarily saying you'll see this every time, but this certainly happened for this lady. The other patients we saw were actually neuropathic, so it wasn't necessarily captured so well for those guys. So we've got a wound area reduction of about 23% within the 3-week mark, and she could go back into a reduced compression now because her pain had improved. By day 49, my maths isn't quick enough, 7 weeks, we're looking at around about a 50% reduction. So considering we've had the wound for nearly 3 years, we're really quite pleased at how well it progressed. And then day 64, we've seen a wound area reduction of 86%, and she went back from coming into the multidisciplinary foot care service. She was back into a regular compression care now, and she went back to community services. So I haven't actually got the closed picture, but she did go on to heal, thankfully. So we'd failed in numerous other therapies. We tried things like negative pressure for this lady, and she didn't tolerate that. Tried topical hemoglobin, and the compression therapy just wasn't working for her because of her pain levels. The big thing for us that stood out was the pain went from a 10 out of 10 down to a 0 out of 10. She did say it started to creep back up over time, but it never got back to the severe levels, and she was still able to maintain compression therapy. And she was very positive about the experience. We did want a video, but she's quite a shy, introverted lady who really wasn't keen to get on camera to talk about it. But she did give us permission to use her words. She said, "I woke up the day after treatment and reached for my pain relief and realised I didn't need it. It's been amazing, and I feel I've got a part of my life back," which was great to hear from a clinician point of view.